Welcome back again to Missi Education Online Health Talk. Today we'll talk about diabetes mellitus in conjunction with World Diabetes Day, which is always fall on the 14th of November of each year. And November is particularly hot topic for diabetes mellitus. So look at the diabetic statistic and quick fact over the world. Diabetic population actually stand at the third largest population in the world after China, India. And 1 in 2 of people with diabetic, they don't know that they are actually have diabetes. So we always have to ask ourselves whether we have diabetes or not. In the worldwide, we have about 371 million people have diabetes, and expected to rise up to 500 million by the year of 2030. And if you look at the 2017 statistics, one of the biggest population is from China because of the population by itself, followed by India, Indonesia, US as well. And of course, Southeast Asia like Malaysia is not spared as well. And it means that you look at this chart, 1 in 11 adult has diabetes, and 1 in 2 actually they are not diagnosed. So look at the global prevalence has increased tremendously over 30 years, from 4.7 doubled to almost 8.5% over the 30 years. And 1.6 million of death caused by diabetes. Look at the Malaysia scenario. We have about 17.5% of the prevalence rate in Malaysia, which is almost equivalent to 3.6 million. And look at the National Health Survey done previous years, from 1960 gone up to 2016, we have gone up tremendously over the years for the prevalence of diabetes in Malaysia. And one of the main cause is because Malaysian also the fattest in Asia cohort. And if you look at the statistic released by Ministry of Health, if you add on undiagnosed diabetes, means that 1 in 5 of adult population in Malaysia will have diabetes. So actually, what is diabetes? It's a state of high blood sugar in the body due to lack of insulin or resistance to the insulin function. So insulin job mainly is to make the sugar in the blood to be absorbed and stored in organs like muscles and livers. But because in this diabetic state, this function was interrupted or impaired. It's either due to lack of insulin or due to resistance to the insulin function. So basically, for public education purposes, we have classified into type 1 and type 2, or old terminology is insulin dependent or non-insulin dependent. And of course, we have the secondary cause, like due to virus, pregnancy, medicine, trauma, and other endocrine diseases as well. Now, how to diagnose diabetes? Now, if the fasting blood sugar is more than 7, then we classify as diabetes. Or 2 hours postprandial test is more than 11.1 millimole per liter, we classify as diabetes. Or the HbA1c, which measure 3 to 4 months, last 4 months average diabetic sugar level. If the marker is more than 6.5%, therefore we label as diagnosed as diabetes mellitus. Now, what is pre-diabetic state? The fasting blood sugar is 6.1 to 6.9 millimole per liter, means it's already impaired and it's a pre-diabetic state. Or if they do a glucose tolerance test, 2 hours postprandial glucose tolerance test, the glucose level is 7.8 to 11 millimole per liter. Or if you look at the UK guideline, if the HbA1c is between 6 to 6.5%, therefore the patient will be diagnosed as pre-diabetic. Now, what are the risk factors that cause diabetes? With the family history, like for example, my parents have diabetes, therefore I stand a much higher risk to get diabetic in my lifetime. Having a BMI of more than 23 because of obesity. Now, the adipose or fat tissue over the abdomen area contribute to the resistance to the function of insulin. Leading an inactive lifestyle, like sedentary lifestyle, they always sit on the couch watching TV, not much active, no exercise, also contribute as a risk factor. Now, high blood pressure, abnormal cholesterol level, these two also contribute to the risk to get diabetes. Had a history of gestational diabetes means that they have diabetes during pregnancy, a lady, and that make the lady has a higher chance of getting diabetes in their lifetime. Or certain criteria, for example, if they deliver a baby more than 4 kg, also stand a risk to get diabetic in the lifetime as well. Now, as we age, our insulin and pancreas function may deteriorate. So aging is another risk of diabetes mellitus. And especially with more than 40 years old, the risk keep on going higher. Now, have impaired glucose tolerance or impaired fasting glucose, as we mentioned, pre-diabetic state, those category of patients stand very high chance to get the full-blown diabetic in their lifetime. Now, what are the symptoms, signs and symptoms of diabetic mellitus? More generally, some may not have any symptoms, and if they have, the common symptoms that we encounter are frequent urination and feeling thirsty all the time. And some of them will have increased hunger, keep on eating, bulimia, and they may have a lot of weight loss, drastic weight loss. One of the very common presentation, weight loss, they feel very tired, they lack of interest and concentration, they can't focus on work, and they may feel numbness over the feet and hands, and they have a blurred vision. Certain infection, for example, urinary tract infection, sore throat, keep on coming and never go away. If they have a wound, cut wound, they're slow to heal. Those are the common symptoms. And if you don't diagnose it or they ignore the symptoms and leave it be, sometimes it may deteriorate, become confusion, coma, even death. And like, for example, they present with the complication called diabetic ketoacidosis. They present in a coma state. Now, what are the complications of diabetes mellitus? Of course, we talk about acute complication, hyperglycemia, coma, like I mentioned earlier, like one of the syndrome that commonly encountered is diabetic ketoacidosis, or hypoglycemia, the sugar too low, especially those on medication, they come in sugar too low, unconscious, come to the emergency department. Now, what are the chronic long-term complications? Mainly, we classify into microvascular, small vessel disease, or macrovascular, medium or big size, larger size disease. Microvascular, particularly involving eye, kidney, and nerve. For example, if they involve the small vessel in the eyes, they contribute to the bleeding into the eyes. We call it retinopathy. They may also contribute to cataract and glaucoma. Now, involve the kidney usually start with the protein leak and eventually renal impairment, kidney function deteriorating and requiring dialysis or transplantation. Neuropathy, it involves the nerve, all the small vessels supplying the nerve impaired, then the nerve may start reduce in sensorium that cause numbness of the feet, or even they don't feel anything if you press on, for example, nail. So they cause wound. If they involve the big vessels like macrovascular, mainly involving brain, heart, and extremities, peripheral vascular disease. If they involve brain, they may have a stroke, either from the thrombotic stroke or even a bleeding hemorrhagic stroke. If you involve the heart, then of course we commonly heard about it, heart attack or coronary artery disease. Extremities mainly involving the lower limbs and cause a lot of ischemia, gangrene, and eventually lead to amputation. Now, these are a few illustrations show the complication that it may involve different organs. And look at the eye, they have a bleeding tendency, bleeding patches over the retina arteries, and they have an exudate normal protein excretion into the retina. This is a typical one of the diabetic foot in our practice that we have seen. You can see it's all swollen up with the infection, and some of the infection are eaten up the toes. Now, heart attack or stroke, They may cause arteriosclerotic over the coronary arteries and cause a heart attack, or they may have a bleed in the brain. You can see here the arteriosclerotic part may block the coronary artery, and some of the plaque may rupture and cause acute heart attack. One of the common complications of diabetes is kidney failure. And 65% of the dialysis population in Malaysia is due to diabetes mellitus. And hemodialysis is commonly found as a way of solution for the complication. The other type of dialysis that we practice is peritoneal dialysis. We use the peritoneal membrane as the filter function to clear the toxin from the kidney. Sometimes we do perform kidney transplant for those without any other option. Now, what are the management of diabetes mellitus? Management, of course, education is the utmost important. Preventive education, again, also as important as secondary education. Like, for example, this World Diabetes Month, it should be used well to educate the public how to prevent diabetes or to diagnose it and the possible complication, how to avoid those complications. Diet play a main role in diabetic treatment. Exercise, medication, like for example, oral medication, insulin, and of course, we have to treat the various complications that involving the eyes, kidney, brain, and peripheral vessels. Now, diet, we have to control the weight, we control the sugar, we have to control the lipid. It has to be balanced diet, protein, fats, carbohydrates, vitamins, and minerals. And we have to distribute the food evenly and individualized diet. Exercise improve cardiovascular fitness, feeling of well-being. We'll be able to reduce the glucose level in the body. We recommend aerobic exercise 30 minutes at least 3 times a week. This is a typical food pyramid for diabetic diet. The bottom part, we can take more, like 6 to 11 serving a day, like bread, cereal, rice, and pasta group. And we should select those with the low glycemic index. If you go up the pyramid, then we can look at the fruit groups. We can take about 2 to 4 serving. So as the vegetables group, we can take more, like 3 to 5 servings. And again, we have to select those food groups with the low glycemic index. We go up further to the pyramid, then 2 to 3 servings of milk, yogurt, cheese group, or meat, poultry, fish, and eggs. And for example, fat, oil, sweet, or sweetened product, canned drinks, syrup, and sugar, heavy sugar product, then we have to take very sparingly. Control hypertension according to the guideline, because diabetes plus hypertension is a silent killer that causes major complication, for example, stroke and heart attack. What are the medications that commonly used in the market now? With time involved, we have so many selection and choices now. I'll just run through a few commonly used. The category first one is biguanide, which is commonly heard like metformin, glucophage. Newer one will be GLP-1 receptor agonist, DPP-4 inhibitors, SGLT2 inhibitors, like for example, Forxiga, Jardiance, and DP4, Januvia. Sulfonylurea is an old product we commonly encounter, like for example, Daniel, Amaryl. And of course, we have insulin or combination of product. Now, insulin is used short-term in acute illnesses, for example, severe infection in ICU setting, pregnancy or emergency setting. It may be used long-term, especially definitely in type 1 diabetes mellitus, or even in type 2 when the oral medication fails. Thank you.